Hey everybody, it's Erik, co-founder, partner of Village Global, a network-driven venture firm. And this is Venture Stories, a podcast covering topics relating to tech and business with world-leading experts. Hey everybody, welcome to another episode of Venture Stories by Village Global. I'm here today with a repeat guest, Vijay Boyapati, except today we're going to be talking about healthcare instead of Bitcoin, although perhaps some of the underlying principles may surface. Vijay, welcome to the podcast.
Thanks, Erik. It's great to chat with you again.
Let's start from the top, Vijay. How did you get interested in healthcare in the first place?
Well, I was interested in economics and studying economics in general. And back in 2010, I had a friend and she knew that I was studying Austrian economics, which is sort of a different school of economics to the standard schools of economics that are taught in universities such as the Keynesian School of Economics and the Chicago School. And she said, hey, we've got these standard perspectives on healthcare that we're being taught. Would you be willing to come and give a lecture to my class? And she was in a public health class at the University of Washington. And I said, sure. So I, applied my understanding of economics that I'd been learning about, Austrian economics, to healthcare. And I presented a lecture to the class, public health class. And it was fantastic. They were really receptive, even though their sort of economic and political views were quite different to mine. They were really receptive to the ideas and they had never heard anything like it before. And it gave me a chance to spend probably about a month doing a deep dive into the economics of healthcare and why is the US healthcare system the way it is? What are the problems? And does it compare favorably to other systems around the world? So yeah, that's how I first got interested back in 2010.
And you wrote this post, What's Really Wrong with the Healthcare System?
That was a companion to the lecture. So I basically gave the post that I did as a lecture to this class at the University of Washington.
So let's present your thesis. What's wrong with the healthcare system?
The biggest problem is that prices are rising much faster than the rate of inflation. A lot of people have brought up the issue that a large fraction of GDP in the US is being spent on healthcare. That's not a problem in and of itself. If that spending is commensurate with, new technologies and techniques that are being used that people want to spend more money on. But unfortunately, in the US, it's not necessarily commensurate with better healthcare outcomes. And so what I wanted to understand was, why is it that in the US prices are rising so quickly in the healthcare market? And there's a whole number of reasons, some of them more significant than others. But I think from my research, perhaps the most significant reason is that the US is based on this employer-provided health insurance system, which is, if you think about it, it's a really strange system to be insured for healthcare. Our employers don't insure us for other things. They don't insure us for food or for a car or for TV, for all these other things. But for some reason, they insure us for healthcare. And that got me interested in exploring what was the history of this. Why did that come about? And it turns out it's a relic of World War II. It goes all the way back to World War II when there were price controls. The US government instituted price controls, so you couldn't increase the prices on basic goods or services. So what happened was one of the ways that employers who were still trying to, attract employees, one of the ways they tried to differentiate themselves with other employers was to provide health insurance and say, look, we can't pay more than our competitors because of price controls, but we can give you health insurance. And so they started doing this. It was codified as a tax benefit that the US government treated health insurance as a special class of service that wasn't taxed. And that got codified into the tax law in the early 50s after the war had ended. And it just sort of by accident became the healthcare system for the US, where you get health insurance through your employer and they they act as a middleman between you and the medical system, the doctors and nurses and hospitals that you deal with. And it has very interesting economic consequences to have this middleman. One of the things that happens is that patients are no longer negotiating directly with doctors. And so when they go to get a procedure done, the insurance pays the insurance that was provided by their company. And if you're not paying something directly, your willingness to pay more rises dramatically. And a classic case of this is you can imagine if someone is traveling, and if they're paying, they're going to be much more cost conscious about the hotel they stay in and the plane ticket they choose. They'll choose economy rather than business or first class. But if the company is paying, it becomes kind of a corporate junket where you say, well, I'm going to fly business class because I'm not paying, and I'm going to stay at the Four Seasons because the company is paying. And of course, there's perhaps some pushback from the company because they might question you about, like, well, this trip seemed more expensive than we expected. But generally, you're going to be less cost conscious when you're spending your company's money than when you're spending your own. So what this does is it increases demand from consumers because they're not paying directly. And it also makes it so consumers are less cost conscious. So if a doctor says, here are two options for your treatment, one is a certain cost and has a certain outcome, and there's another option which is much, much higher cost, which we think perhaps has a slightly better outcome. If the patient's not paying, they're going to take the more expensive option. And this tends to create healthcare that is more expensive because it's driving demand for the more expensive healthcare. So there is a bit of a feedback mechanism because companies have an incentive, they're profit motivated, and they have an incentive to push back on providers of healthcare and say, this seems really expensive and it's starting to cost us a lot, so we want to negotiate a better deal. But another thing that happened in the 60s was that the government provided Medicaid for elderly citizens. And in that case, the employer switched from being a company to being the government, and the government was providing health insurance to everyone above 65. And the government doesn't have a profit motive like a corporation does. It doesn't go out of business in the same way. And the motives of the government are not so much economic, but political. And now you have all these people who are above 65 who are getting healthcare through the government, and they're not paying directly, the government's paying for them. So these are people who vote, and the government has a huge incentive. People inside the government, congressmen and senators, have a huge incentive to say, we will drop the cost of healthcare for elderly citizens. And so elderly citizens can then demand more and more costly healthcare, and this tends to drive up the price of healthcare for everyone. So it's a combination of the employer-provided healthcare system and the government stepping in and providing insurance to a large fraction of the population, which I think is probably the primary cause of the growth of the cost of healthcare in the US, far above inflation as compared to other countries around the world.
And can you unpack one more time? Why is employer funded a problem if, as you mentioned, corporations are profit motivated?
Because the price sensitivity is much less when you're getting a good or a service through your company as opposed to getting it directly as an individual. If you're paying out of your pocketbook, again, I'll go to the example of buying a plane ticket. If you're paying directly out of your pocketbook, you're going to be very cost conscious. You're going to look at all the different options and find the best possible ticket at the lowest possible price. Whereas when someone else is paying on your behalf, you're going to look for the most expensive option that gives you the absolute best treatment, even if the treatment is only marginally better than a much cheaper alternative. So it tends to create an incentive where healthcare providers will create options which are only marginally better, or perhaps are just the same and are marketed as being better and are far more costly, because they know that the customer isn't dealing with them directly. They're dealing with a company. And companies as well are, hamstrung because there's a lot of privacy issues around healthcare. So if one of their employees requests a treatment which is very, very expensive, but it's not clear that it's more effective from a healthcare outcome, the company can't really step in and say, hey, this doesn't seem like a good idea. We want you to take the cheaper option because it's not clear that the more expensive option has a better outcome. So because of those privacy issues and the fact that consumers aren't paying directly, you have far less price sensitivity at the level of individuals choosing healthcare options.
And what's the counter argument for employer? Isn't it that they can negotiate rates and buy bulk, et cetera? Or?
Yeah, I guess you could say that companies can negotiate, but I just think that's a marginal effect compared to the demand side. I don't have a strong counter argument. I don't think there's good evidence that companies are negotiating really good fees from providers. And as an example, if you ever go to a healthcare provider and say, look, I don't have insurance, I would like to pay directly in cash, the numbers that you'll see are just absolutely stupendous for some of the treatments that, you're not spending much time at the doctor's office. And in my article, I gave an example where I had a very, very small medical procedure which took 15 minutes, removing a small cyst, a superficial cyst. And I remember going to a healthcare provider that typically took insured patients, and they said it would cost $700 to do the procedure, 15-minute procedure, which is the equivalent of about $2,800 per hour for the procedure to be done. Then I found that another provider which deals more with cash paying patients, people who don't have insurance, and these are people who, are much more price sensitive and are not going to be willing to pay a large amount if their doctors give them, a direct bill which is really high. And the fee was much, much lower. I think it was maybe $50 or $100. I mean, the procedure was a no risk procedure. So I'm very skeptical of the idea that companies are getting better deals with these insurance providers. I think there's a gigantic amount of bureaucracy involved, and they're not negotiating at the level of an individual treatment. They're negotiating the level of these huge insurance packages, and I just don't think that's an effective way of negotiating a price on a consumer good or service.
Yeah, if you look at the U.S. health system, it seems that everybody's got major problems with it. People who want it to be more free market system are saying, hey, this is nothing resembling a market. And yet people who want, universal healthcare or, government funded healthcare are saying, hey, this is nothing resembling what government funded healthcare should look like.
Yeah, it's true. It's a monstrous hybrid. And I think, to argue the point that it's not a free market, I think one critical thing is there's really no price function. The most fundamental thing about a free market is there's a price function and that people can allocate resources based on the price of different things. If the price of a certain good or service is going up, more people will allocate resources to it because it's profitable to do so. A classic sign that there's no price function is just ask any patient, not even a patient, ask any doctor, what is the cost of this procedure? And they cannot tell you. Ask a doctor delivering a baby, how much does this cost? Doctors have no idea. They are providing a service and they don't know how much is being charged for the service they're providing. That is just not true in any other industry. And that's a huge problem because you no longer have a price function which connects the consumer and the producer anymore. So the allocation of resources gets really sort of messed up. So I don't see evidence of this being a free market at all. It's a really horrible hybrid system. But I think it's better than a single payer system, but it also has the problem that costs are constantly going up. The problem with a single payer system is that the costs are kind of hidden. When you have a single payer system, you also don't have a price function. You have the government allocating resources directly and saying, we need this many doctors for this profession and this many doctors who are anesthesiologists. The real problem with that is it's impossible to allocate resources rationally when you don't have a price function. This was one of the great insights of the Austrian economist Ludwig von Mises. He predicted that socialism would fail in the 1920s before, the horrible communist experiment of the 20th century. And the reason he predicted this was because communist countries don't have price functions. They don't have the ability to rationally allocate resources because they don't know what the demand for these resources are. They're just kind of guessing. And when governments do this, they're essentially rationing resources in one area and over allocating in another area. And the problem with that is people don't really see that the consequences of this directly. It's kind of an unseen cost. What it means is that someone who wants a procedure, let's say they need a hip replacement or something of that nature, they may think the procedure is free because the government is providing it in a single payer system, but they have to wait. They have to wait potentially years to get the procedure done, and the cost is that wait. And for some people, the cost is life or death. Waiting means death. And there's no way that they can say, hey, this is really important. I need to get this done immediately, because the government has allocated resources to the particular subfield. And governments move really slowly. It's not like they can see an uptick in demand for hip procedures and say, we need to respond to this immediately. That's how the markets function. And so the cost in these single payer systems is seen in treatments just not being available, whereas the cost in the American system is seen by things just being really expensive if you don't have insurance. So they both have huge problems, but I would prefer a system that is expensive but you can get a treatment versus something that is free and you potentially wait for years.
But what about people who point to, I don't even know which countries are single payer, is it United Kingdom or Canada or Israel, and say, hey, look at how successful, is there an example of a single payer system in your mind globally that is very successful?
No, I don't think so. I think that the UK and Canadian systems are a huge disaster, and there are plenty of stories of people dealing with catastrophic failures of those systems because of the way they're managed by the government. And I think a good sign of the failure of the Canadian system is you just look at the direction people cross the border. Do people cross northwards to get healthcare treatment, or they cross southwards? And this is generally true of political systems as well. The Chinese communist system versus the free market Hong Kong system. Which way did people cross the border? Did the people from Hong Kong leave and flee to China, or was it the other way around? And when you look at this, it's Canadians leaving because they can't get treatment. They don't want to wait, so they come to the US and they pay and they get relatively good treatment. I don't buy into this. I think this is sort of an ideological point where people say that these places have good treatment because they're quote free. But there's no such thing as a free lunch. You don't get free healthcare. The cost is the time that you wait and the quality of the treatment. And in terms of those things, despite its problems, the US still has one of the best healthcare systems in the world.
So if you could wave a wand and change anything that would make the U.S. healthcare system more market-oriented, what would that be?
Well, I think it's really hard to change the system because there are so many entrenched interests who will lobby very strongly to keep it as it is, especially the health insurance providers like the system the way it is. They make a lot of money off it. I think the one thing that I think would help increase price sensitivity would be to just increase deductibles. So make people pay more out of pocket for treatments. It's just the idea actually of insurance is very strange. Insurance is meant to be for unexpected, catastrophic type events in a person's life. It's not meant to be for routine treatment. So much of healthcare is, routine stuff. And it's just strange that we pay it through insurance. We should be paying it directly. The way I think it would work if it was an effective system is you'd go to the doctor and say, I would like my routine checkup. Here's $150. And there are actually little pockets of the healthcare market where this happens, and you can see from these pockets, little microcosms of a free market, how effective the free market can be. In my article, I talk about LASIK eye surgery as an example where it's typically not insured, so people have to pay out of pocket. And over the last 15 to 20 years, there's been a dramatic decrease in the cost of getting one of these procedures. They're far more efficient at doing them, and the quality of the outcomes is much, much higher. And this is the kind of thing you expect from a free market, such as the technology sector. This is the kind of thing you expect: prices dropping and quality going up. Every year the quality of the iPhone goes up. That's what you expect. But for some reason, it's not true of healthcare, except in the instances where consumers are paying directly and where there's very high price sensitivity and consumers become very discriminating. It provides a very strong incentive for producers of healthcare to improve their game.
Isn't there an argument that if people were paying out of pocket, they would likely pay less for preventive care? And that's one of the big problems with our system, is that people don't spend enough in preventive health care?
Yeah, but, I think that's more of an educational issue. And I think people, if they're educated about what's necessary to live a long and healthy life, they will know that preventative care is important. And I don't see that as necessarily an economic issue, but more of an educational one, and people not being fully aware that they need to get their regular checkup, especially after they get past 40 or 50 in age. It becomes much more important.
Totally. What do you think about, what are would you say, the best criticisms of free market healthcare, or what makes healthcare sort of uniquely challenging to incorporate markets?
I think the idea is that we humans have natural empathy, and the idea that people could be left in a dire situation because of a physical ailment or a disease that they get that is of no choice of their own. The natural empathy of a population sort of makes it hard for us to, as a society, countenance allowing people to just die. That's the outcome that I think proponents of socialist healthcare really lean on. But I think the problem is, if you want better healthcare for everyone, you need to have the innovation and capital formation that you see in other fields that are free markets. You don't solve the problem by introducing government planning into the situation. And you really have to think about, there's this confusion between healthcare and health insurance. Unfortunately, in our society, the two terms have become synonymous. But really what you want is better healthcare outcomes. You want more and better doctors who are trained, more and better treatments, medical treatments, better technology. And for those things to exist, you need the free market to work. If you take a society that is impoverished and institute health insurance, it doesn't mean that they're going to suddenly have good healthcare outcomes. The healthcare comes from the development of medicine, and that takes time and capital formation and innovation. And it seems so simple to say, let's just give free healthcare to everyone, but in the long run, the effect is actually very negative because it hampers the growth of the healthcare market.
What healthcare systems globally outside the US can we learn from, and what is it from them that we can learn?
I think we could probably take a look at the Singapore healthcare system. I think it's rated the best in the world, and they are a very free market oriented society, but they also don't want anyone to be without healthcare. So they've sort of thought about it in a different way. And so they do have a social safety net, but it's just not implemented in a really ineffective way that it's done in the US. So if the government is going to be involved, and I think given the nature of our society, it's very difficult to imagine that it's not going to be involved. It should at least look at systems that have worked effectively. And I would point Singapore as an example of that.
And so what is the proper government role in healthcare?
Well, my point of view as a libertarian is the government should have no role whatsoever in healthcare. I think the quality of treatment would be much, much higher if the government stepped out of healthcare. And in the cases where you have people who do not have the ability to pay for their own healthcare and are suffering an unexpected healthcare outcome, it should really be up to private charities and private foundations to help them, not the government. And that's generally how it worked before the healthcare system we had was created in the 1950s. If someone in a community needed medical help and they couldn't afford it, their local church would help them out. I just think that's a much more moral system than forcing everyone to pay into this large corporate bureaucratic and ineffective system. And one of the things I talked about when I lectured this class, a public healthcare class, was the morality of government healthcare. And that's something that they hadn't really thought about. And I made the point that when the government creates legislation in any field, it requires the force of the government to enforce it. And what you're saying is if someone doesn't want to be part of this healthcare system that they think is ineffective, the ultimate outcome is jail. You're willing to throw someone in jail because they don't want to be part of a system that they think is immoral and ineffective. So that's my point of view. I don't think government should be involved. But if it is going to be involved, it should take a much more free market-based approach, and it should look to countries which have done that. And I think those countries in general have provided healthcare in a much more effective way than ones which have used single-payer systems.
Yeah, I think Singapore, only 4% of their GDP is spent on healthcare with better outcomes.
Yep.
So if you mentioned perhaps the entrenched interests, so it's sort of politically infeasible to imagine sort of a world like this, and yet. So two questions. One, you gave this talk almost a decade ago, 2010 to 11. Has anything changed since then? And then sort of looking forward, if you look out 10 years out, 15 years out, do you expect any big changes to our healthcare system, and what would have to happen for big change to occur?
Unfortunately, I don't expect any changes. As I said, I think the interests are far too entrenched and far too powerful to change anything. And the political base is also so vested in the current system. With Medicaid, you have a large block of baby boomers who are basically got free insurance from the government, and they're not going to give it up. So it's gonna take a bankruptcy of the federal government for a significant change. I mean, you can make changes around the margin. And one example was something Trump was trying to do, which I think was actually a good idea, which is make it so that healthcare providers have to compete with each other across state borders instead of only having competition within the state borders. I should be able to get insurance from a New Jersey provider if they have better insurance than the ones in Washington where I live. So that's kind of an obvious idea. You could encourage health savings accounts which provide people with some money where they're able to pay for healthcare services. But that only really helps if you're also making it so that the services themselves need to be paid more out of pocket. And so potentially one way of doing this, since I don't think you can really change healthcare for people who are above 60, is you could make it so that the deductible for young people is much higher, so they have to pay more out of pocket, and sort of phase out the old system in stages. That might be a politically feasible way of doing it, but even that really, it's such a hot potato. No one wants to change the way it is, because you imagine you're a politician and you say, hey, I want to remove all of this free stuff. It's not going to go down well. The political incentives are aligned to create people who will expand the current system rather than reduce it.
It's almost as if we have a higher chance of achieving the singularity or having nuclear war or AIs take over the world before we have a massive healthcare shift.
Yeah, it's unfortunate. That's one of the downsides of democracy. Is I think Milton Friedman said there's nothing so permanent as a temporary welfare program, and that's really what happens. When you create a welfare program, it creates an interest group who are very, very motivated and in general, the rest of the population doesn't have a strong opinion. And so that motivated group will drive the system to expand, and they will be a very motivated voter base to keep the system in place.
Do you think there are any parallels between your interest in Bitcoin or in the underlying principles underlying Bitcoin and healthcare?
I guess you could say decentralization. I mean, free markets are about decentralization and kind of the antithesis of central planning. And I guess I could say there's a similarity there. I believe in market outcomes and markets as a way to allocate resources and create innovation and new technology and wealth for the great majority of people in society, as opposed to governments centrally planning and deciding how the economy should be managed. And, I think if the 20th century proved anything at all, it's that central planning is a disaster on a massive scale, and it needs to be avoided wherever possible.
Any areas where you think there should be central planning / what is the proper role of government outside of health, just role of government in general?
Well, there's a spectrum of libertarians, and I'm pretty far along the spectrum. I would say that ideally everything should be provided by the market. If the government is going to provide anything at all, it should be defense against external threats and the provision of justice inside the society. So, prosecuting crimes and preventing crimes and providing peace and order. So I guess you'd say a military and a police function is the only conceivable role that is, I think, appropriate, if that's appropriate at all.
How would the Austrians view Trump today?
I think it varies. I think, that there is a spectrum of libertarians, and some are very left-leaning and some are much more right-leaning. And, I think some libertarians are absolutely appalled about Trump.
From an economic perspective?
From an economic perspective, I think the libertarian perspective would be, against the sort of mercantilist policy that he's pursuing of, trade wars with other countries. The libertarian perspective is that the US should open its market regardless of what other countries do. But then I think a lot of libertarians would be supportive of his tax reduction policy that he passed, I think it was a few months ago. So yeah, I think it's a mixed bag. I don't think there's one definitive perspective on Trump. I think libertarians would be happy with some things and upset about other things. Yeah,
you also mentioned in your piece 3 other things that led to rising prices. 1 is occupational licensing, 2 is obesity, and 3 is IP. Can you sort of walk through each one?
Sure. So the biggest one I mentioned was employer-provided health insurance. But the next one I mentioned was licensure, which is basically credentializing a profession and saying that you're only allowed to practice in this profession if you get a credential from an authority. In the medical profession, it's the American Medical Association, which decides who can practice as a doctor or not. And while the idea sounds good, it's preventing poor quality doctors practicing, it actually turns out to be a way of restricting supply in the market, and it affects who and how medicine can be provided. And Milton Friedman had a quote about this that I quoted in my article, and I have it here, and I think it's worth reading. He said, "It is clear that licensure is the key to the medical profession's ability to restrict the number of physicians who practice medicine. It is also the key to its ability to restrict technological and organizational changes in the way medicine is conducted." And I gave an example in my article where I pointed out that there were some low-cost clinics, like at Walmart, which had nurse practitioners who were providing flu shots, and the AMA came in and shut them down. They said, well, you're not allowed to do this unless you have a licensed doctor on the premises. As an example of a healthcare service that could be provided at very low cost, but now has to become much more expensive because doctors are more expensive than nurse practitioners. So the AMA not only restricts the supply of people who can become doctors, but the way in which healthcare is provided by people who are not quite as qualified. And so that tends to increase the cost of low-cost services as well.
Are you familiar with the cost disease argument that basically says that one of the reasons prices might be rising in healthcare is because they're decreasing in other industries, which thus is pushing wages up in healthcare, which is not as productive of an industry?
I don't buy it. I don't think that's true, because I think healthcare can be as innovative and productive as any industry. It's just hampered by the regulations that surround it. And if you're a startup person, you'll know this. I was in Y Combinator, and one of the things I remember vividly is of all the batches that had been there before me, there was almost no healthcare startups. The amount of red tape that you have to cut through to do anything in healthcare is just ginormous. So there's far less innovation in that market, but it's because of regulation. It's not because it's inherently a less innovative or productive industry. There are so many things you could do in healthcare if you had less regulation.
And give more color into who are these entrenched interests exactly, and what regulations could be changed in theory that would not give them either monopoly or undue power. Is it insurance companies? Who are these entrenched interests?
Yeah, I think the insurance companies are probably the big ones. And the AMA, of course, is, these licensure organizations are the other ones as well who restrict supply. Yeah, and the other big problem is that the government regulates the amount of information that can flow around in the market. There are very, very strict privacy regulations around healthcare, which just makes it very hard to move information. Even companies as big as Google and Microsoft had tried to get in and build software that would allow people to take their health records from one, hospital to another, or one doctor to another, and they abandoned the efforts because it was just far too complex to navigate the regulation. And so you can see this when you go. I don't know if you've ever gone to get a flu shot at a clinic. If you haven't been there, they give you this form that you have to fill out, this paper form, this antiquated paper form, like from the 19th century, that they keep on file somewhere. And it's just really ridiculous. You should have an account which has your medical history that should stay with you and should be able to move between providers. But we don't have that. The patients don't have the ability to do that. And it's not because that's a difficult thing to do. You understand, this is the technology to do that's very simple. But the kind of things that you have to do, the kind of regulations you have to comply to do it, means that no one wants to actually build it, because the cost of doing it is much higher than the benefit of doing it.
And did Obamacare only make things worse?
In my opinion, it did. I think the biggest problem was that it really, tried to extend the benefits and decrease the deductibles for people. So it actually decreased people's price sensitivity. And I think what you see is that healthcare premiums went through the roof, and just the cost of healthcare in general increased a lot after Obama's legislation was passed. And I think it's one of those situations where the people and the companies paying for healthcare, it got almost to a point of crisis. And I think that's why Trump tried to fix the system. And as far as I can tell, I haven't really investigated this in as much detail as I did in 2010. I think he was quite ineffective in trying to remove regulation and reform the system. I'm a bit of a pessimist. I think that we're going to have to wait until we have a huge financial crisis, when it just becomes clear that there's no way to pay for such a system, and the whole thing collapses on itself before we get something better.
Do you foresee a big financial crisis in the next decade around this?
I mean, I think the biggest financial crisis isn't going to hit the US first. I think it'll hit other countries first. In terms of its debt to income ratio, the US is in a fairly good position. I mean, I'm not going to say it's excellent, but countries like Japan and parts of Europe are in much, much worse shape than the US. I mean, Japan, for instance, is using all of the income it receives from taxation to pay interest on its debt, which is a very, very precarious position to be in. If the interest rates spike in Japan, then they can no longer pay their debt, and they potentially have to default. The US is still able to service its debt, and I expect will be for quite a while. I don't know when this crisis will happen, but we're certainly on the path to it. Whether it happens in 10 years or 20 years or 50 years, that's not completely clear to me. But unless you have significant reform, it will eventually happen, because we can't afford a system where the cost of healthcare continues to increase indefinitely.
Zooming out a little bit, what is the Austrian view on sort of the, or on frameworks for how to think about, a deficit or debt and whether something's manageable or not, or what should be ideal?
Well, I think Murray Rothbard wrote an article which was that the government shouldn't be carrying any debt, and it would be better if the government just defaulted on its debt. And if it didn't have any debt, then it wouldn't need any taxation either. So the Austrian view is that we have far more debt than we need. If you're just talking about whether or not it's sustainable or not for the people who don't have that same moral opinion, you need to look at whether tax revenues are funding the interest payments on the debt. And if you have a lot of leeway there, then the country is probably going to be able to continue with the system that it has for a long time. And the US does still have a lot of leeway despite the massive debt that it has. The US brings in a lot of tax revenue, which much more than it needs to pay out in interest every year. And that's also partly because foreign nations' willingness to fund US debt, which means that we have much lower interest rates. And so we're in this kind of lucky position that we can sell our debt at very generous terms, and so we don't have to pay that much interest to continue to service it.
Totally. I mean, you mentioned earlier the problem with democracy, and I don't know if you'd go so far as to say that capitalism and democracy are incompatible. But what is your sort of ideal, government or political system, or if you could change anything about our existing system with a wave of a wand, what would it be?
I prefer a totally free society where individuals interact with each other peacefully and without coercion, and so some call that an anarchist system. But it's highly unlikely. It's kind of an ideal that I think people should strive for and advocate for. But in terms of systems that have existed, I think an ideal would be much more of a sort of city-state system, kind of like the system that existed in the Renaissance in Italy. We have a bunch of really small city-states, and they're competing for the best talent, the best minds to live in their city. And so you have cities providing the best service possible and providing patronage to the greatest talents that are alive at the time. And so, I think it would be great if the world was a bunch of much, much smaller countries. And that's sort of, you could think of that as sort of the way the founders envisaged the creation of the United States. Each of the states was their own political system that had most of the power, and the federal government was to have very little power. But over time, much of the power has been arrogated into the federal government. And so that view of essentially a whole collection of small nation states with a very small superstate that sort of sat on top of them has morphed into this monstrous federal system where there's a massive amount of power concentrated in Washington, D.C. But ideally, I imagine America as a bunch of city-state countries. I think that would be by far provide the best outcomes for the people. Each city would cater to the demands of its own population and wouldn't be subject to the whims of politicians 1,000 miles away who have no idea what's important in Seattle, for instance.
And what led to that consolidation, or was it merely inevitable?
I think it's inevitable. I think power consolidates, and if you create a central government, it's going to arrogate power to itself over time. It's just the nature of politicians and politics in general. When you create an institution which has authority over a large group of people, it's going to try and increase that authority.
Is the EU closer to what you have in mind, or no?
It's interesting. The EU they're trying to model the American system, but the nations themselves are far more sovereign, and they don't want to give up their power. So in a way, you could say it's closer to what the early founders had envisaged with the United States. But it seems that they want to mimic what the US is right now. It's just very difficult for them because the individual countries don't want to be part of it. They don't want to cede their sovereignty to Brussels.
In those city-states, should they be run democratically, or is democracy the right format, and if not, why not?
No, I mean, if you look at the Renaissance, which is, I think, one of the periods of the greatest flourishing of human civilization in all of history, they weren't run by democracies. They were run by essentially CEOs, like monarchs. And Singapore is another example of a country which is essentially run in a monarchistic way. And to me, this seems relatively obvious. If you've worked at a company, great products, great technology, they're not built by committees. They're built by visionaries and people with executive leadership and the ability to lead teams. And I think, the idea of a monarch seems kind of scary to the modern ear because of the idea of centralized authority in a single person. It sounds kind of like a dictatorship. But when you have very small monarchies that have to compete with each other, they're kind of checked. Their power is checked by the fact that if anyone is unsatisfied with the way their monarch is running their small city, they can just leave and go to the next one across. And so that creates a strong incentive for the rulers to provide good services and provide a society that will attract the best from around the world.
Totally. Where do you depart, if at all, from your friend Patrick Friedman in his view of competitive governance?
That's a good question. I'm not sure. I'm sure I'm very sympathetic to his views. Patry is one of the sort of leading figures or founding fathers of the seasteading movement, which is the idea that you should have experimentation in governance, and that the best way to do that is to create a bunch of small states which run their government in the best way that they see fit and have them compete with each other. It sort of seems to me that he's trying to recreate the model of the Renaissance in a modern society out in the ocean, where you have these little floating islands where people can go and create their own systems of governance that they think are appropriate and effective.
What are some prominent sort of Austrian or libertarian arguments or tenets that you disagree with?
That's a good question. I consider myself an Austrian economist. There are some economic areas where I've disagreed with prominent Austrians, and they're related to monetary theory. So, for instance, I think some very prominent Austrians did not understand how Bitcoin could be possible, and they were enamored of the idea that money must originate as a physical commodity like gold. And so they ruled out Bitcoin as ever being money. And so I think they made a huge mistake in terms of interpreting the regression theorem, which is a theorem of Austrian economics, which tries to describe how money gets its value today and how do you trace that back into the past. And the other area, I guess, that I disagreed with some Austrians on was back in 2008, or in the Great Recession, the Federal Reserve increased its balance sheet by several $1 trillion. And a lot of Austrians thought that this would cause rampant inflation or hyperinflation in the US. And I strongly disagreed with that. And I also wrote a very long article explaining why I thought those views were mistaken. But those are not differences of philosophy or morality. There's sort of economic disagreements.
Speaking of economic disagreements, if you talk to someone like Tyler Cowen, an economist, he'll say that, in his opinion, the Fed has actually done a pretty good job being consistently at, you think it's been 2% for quite some time. What do him or other sort of conservative, but maybe not libertarian or Austrian economists not see, or where do you guys fundamentally disagree?
Well, I would ask, how does he know that the Fed has done a good job. I mean, it's not like we can see the counterfactual. We can't see the world in which the Fed does not exist. Perhaps that world is a lot better. The 19th century saw the greatest increase in the lot of the average man that has taken place ever in history, and that was a period in the United States where, for instance, life expectancy increased dramatically in the 19th century, and that was a period where there wasn't really a central bank at all. So, you know, the counterfactual world that he's ignoring could be much better. Maybe now the average life expectancy, if we hadn't had a central bank, would be 150. So it's not clear to me that you can just look at the way the world is now and look at a superficial metric like the inflation rate and say, yes, they've kept inflation close to 2%, and that's a good thing. Well, what about the financial crisis? I think they did a terrible job managing that. They didn't see it coming, and when it came, their response was even worse. They, instead of letting some of these banks be liquidated who had made these awful loans, really poor judgment on the part of the banks in loaning to people who had no ability to service their debt. Instead of letting those companies be liquidated in the way they would be in any other market, they saved them. And really the problem with that is it prevents the reallocation of that capital. All of those people who are, working in those industries are kept in those industries when they potentially should be doing something else. Maybe they should be working on Bitcoin, or maybe they should be working on healthcare. But instead, because the government stepped in and provided a massive amount of liquidity to these failed banks, you still have a financial sector which is a much larger fraction of GDP than it otherwise would be. So is it a good outcome? It's not obvious to me at all, and I think he would have to address, or at least think about, what the world might look like without an institution like the Federal Reserve.
Is the Austrian view of sort of the state of nature closer to Hobbes, world where it's sort of people are naturally not good, to summarize or generalize wildly, or closer to Rousseau's noble savage theory of the natural state of human affairs?
I think the libertarian view is that humans are neither, beasts or angels, and that either way, if you assume that humans are angels or you assume that they're beasts, we are better off with a more market-driven society. If humans are in fact angels, then why do we need the government? It just doesn't make any sense, because, in the case that people need to be taken care of, we are good-natured enough and charitable in our natural inclinations to help those who are less fortunate than us. And if humans are beasts and inherently evil, then we're giving those people who are evil this incredibly powerful weapon, which is the nation state, with which they can do massive damage to society and the rest of the world. And the nation state and the political system attracts the worst kind of evil people. So that is people who desire power over other humans. And so in either case, the libertarian would argue that we're better off with a freer society.
Why aren't there more libertarians or Austrians, or really any, in government or political power, or just more? I know it used to be mainstream, but why is it not more mainstream now in our power system, whether it's CEOs of some of the biggest companies in the world, or in our government and political system?
It's a hard idea to wrap your head around. I think it's easy to think about someone taking care of all the problems that you don't have control over. It's just a natural inclination. Why have humans believed in religion for all of history? It's just easier for us to fill in the blank with an authority, I think. It takes time and effort. So to become a libertarian took me many, many years of, intense thought and questioning my own beliefs. And I left Australia as a very liberal person who was steeped in left-wing ideas from an Australian university. And it was only, maybe a decade of questioning those ideas that I came to be a libertarian. And not everyone is interested in doing that, questioning their political ideas. Most people, I believe, absorb their political ideas by osmosis from the people around them. They don't have the inclination or the time, which is fair enough, to think about these things in detail. They just want to live their lives, and they assume that the status quo is legitimate, and they just go with it. And that's why, unfortunately, some of the most evil systems, evil political systems that have existed on Earth didn't have as much pushback as you would have hoped. People just go with the flow. They go with what is currently, in place.
If magically out of the air you were given a pool of money, perhaps like $100 million, and all you could do with that money was try to spread or popularize libertarian and Austrian ideals, what would you do with the money? What do you think would be the most effective use?
That's a great question. I might try to fund an institute like the Foundation for Economic Education or the Satoshi Nakamoto Institute. I think is another a great institute providing education about Bitcoin, which I think is an innovation which allows us to have a free market monetary system outside of the realm of our current system. And it may be the case that we can't reform our current system because the interests are too entrenched. And so the only way that we can solve the problem for those of us who believe in a freer society is to go around the system and build something that can't be co-opted. So funding that kind of thing, I think, might be the best use of that money.
Cool. Any last things you want to cover?
Maybe I should say a couple of words about the two other major things in the article.
Yeah, please.
So one of the things I brought up in the article was obesity is one of the biggest problems in terms of the cost of US healthcare system. And, some people will point this out as a market failure. People are just eating way too much, and the cost of goods is too low, and the market is providing all these awful foods that are exacerbating the obesity epidemic in America. But the truth is that the obesity epidemic only really began in the 70s, and it began right after the Farm Bill was introduced in the early 70s by Nixon, and it provided huge subsidies to grain producers. So what you had was a massive surplus of grain being produced in the US, corn and wheat, and so the producers of this grain looked for ways of selling the excess, and one of the things they did was turn corn into sweeteners. And so now in the US, high fructose corn syrup is pervasive it's everywhere. It's in all sorts of goods, all sorts of foods that you wouldn't expect it to be. And this has had a huge impact on the obesity epidemic, because what you'll find is the unhealthiest foods, the ones which have got subsidized high fructose corn syrup, are much cheaper than healthy foods that you would expect people who are healthy would eat, fresh fruits and vegetables and that sort of thing. So the Farm Bill tilted the economics of food production towards the unhealthiest foods. And so this is an example not of the free market gone awry, but of government intervening and providing subsidies and having huge negative unintended consequences. And the last thing I talked about in my article was intellectual property and how this affects the cost of healthcare. And the example I gave was essentially intellectual property grants a monopoly on an idea. And what happens is with intellectual property is that people will do some research and they'll get a patent on it, and then they can charge monopoly prices on the goods or services that they're providing. And an example of this was an HIV treatment, which when the monopoly ended, when other companies were allowed to provide generic versions of that drug, the treatment went from like $750 down to about $10. So intellectual property is another huge problem for the healthcare market, because a lot of these drug manufacturers get long-term patents on the treatments that they've created. And the argument against that, of course, is that there would be no drugs created if we didn't have patents. But there's very good evidence that that's not true, and that you would still have people creating new technologies and treatments without patents. And you can see that in the world of software. It's much harder to get a patent on software or a software idea. and yet we still have tremendous innovation. There's still a great benefit to building something innovative and selling it to the public. And there's two great books that I cite in my article about the possibility of a market that isn't built on intellectual property.
Totally. Cool. One last question for you.
Yeah.
Why isn't Milton Friedman a libertarian or Austrian?
I think he just grew up in a different educational system. He wasn't exposed to. I think it's sort of a historical quirk. The Austrian school developed in Vienna, and Milton Friedman was going through school, not really aware, I think, of any of the work that had been done over in Vienna, and he became aware of it after some of these Austrians had fled Europe to come to America, and then he crossed paths with Ludwig von Mises and Friedrich Hayek, more notably with Hayek at the University of Chicago. And he wasn't familiar with that school of thought, I don't think, and the school of thought that he sort of grew up with was very antagonistic to the ideas that the Austrians had. So I think it's kind of a quirk of history and of time and place that he wasn't exposed to Austrian ideas earlier in his career.
Cool. Well, Vijay, thank you so much for coming to the podcast. Where can people learn more about you online, or what should they stay tuned for?
Publish some of my thoughts on Twitter, so real_Vijay at Twitter, and you can find some of the articles I've written there linked from there.
Awesome. Thank you so much, Vijay. Talk to you soon.
Thanks, Erik.
If you're an early stage entrepreneur, we'd love to hear from you. Please hit us up at villageglobal.vc/network catalyst.